mentor and also the chair of the social media team of the Indian Society of Nephrology. Uh, I'm here today with another episode of Kidney Conversations, the podcast that comes to you from the Indian Society of Nephrology's social media team. Uh, this podcast, Kidney Conversations, is available on Spotify and Amazon Music. You people should listen to it on your radio as you travel the long distances that you have between your house and hospital, especially in Bangalore. You can actually do it because it takes a pretty long time to get to the hospital. I have with me Dr. Shyam Bansal. He is the Honorary Secretary of the Indian Society of Nephrology and the Director of Nephrology and Transplantation at Medanta Hospital in Gurgaon, New Delhi. Welcome, Dr. Bansal. How are you doing?
Thank you. Thank you, Dr. Kanchi, for this nice introduction. And congratulations for starting this secondary conversation. This has been very helpful actually to reach out to our members and general public as such to create awareness about kidney disease. And I think you are doing a great job by doing this. Thank you.
Thanks, Dr. Bansal. So we'll move to the question straight away. Basically, we're looking at the World Kidney Day that's coming up on the 13th of March. And there is a slogan, there is a tagline for the World Kidney Day which says, "Are your kidneys okay? Detect early, protect kidney health." What do you think? Who are those patients who are at risk for kidney disease and need early screening?
Yeah, I think this uh, screening for kidney disease is very important and pertinent. This kidney disease is quite common. Actually, if we do the screening, then we find across the world and Indian studies also that 10% approximately people in throughout the world they have some form of kidney disease, and most of them they have early stages of kidney disease. But in clinical situation we see that we get a lot of patients who are already in the later stages. At that time treating these patients is difficult, and then many of them present to in the end stage kidney disease. So there are certain group of patients who are at high risk. So obviously India is a developing economy, we cannot screen everybody because this is not cost effective. But some people, those at high risk like patient with diabetes, because diabetes is the most common cause of kidney disease, approximately 40% patient of kidney disease is because of diabetic. Then the patient who has hypertension, especially uncontrolled hypertension in the young people. I see a lot of young patients who come to me with kidney disease in the young age. They have hypertension which they have ignored for years, and then later on they are found to have advanced stages of kidney disease. People with cardiovascular diseases, because cardiovascular diseases are one of the most important risk factor for kidney disease. Obese people, and obesity is again a risk factor for kidney disease, and the patient who had family history of kidney disease. This is again a very important cause of kidney disease. So I think these at least five group of patients they should do their screening at least once in a year, and they should do their kidney function test, urine albumin creatinine ratio to detect the kidney disease, kidney problem if they have any in early stages, so that we can prevent them or at least treat them and slow the progression.
Right, and it's very important to tell our general public that the blood test like a creatinine and urine protein is very cheap, less than 500 rupees both put together. And it's very important for them to go and get themselves screened, especially the high risk group that you just talked about. I just want to move on to the indiscriminate use of native medicine in our country. Obviously, they've not undergone any scientific trials, and some of them can affect kidney function. How do we tackle this?
So we all see, the India is an ancient civilization, and a lot of Ayurvedic and the other alternative form of medicine they are being used for ages. So up to a certain extent, for the common illnesses, we all use these remedies at home. But then using these remedies without proper trial, and in a lot of patients, because these drugs have not been medicines have not been tested when we have new methods of the diagnosis, blood test and the ultrasound and the CTs and an MRI, and giving these medicine can actually harm patient, you and me, and most of our colleagues. A lot of people who actually take these medicine in the garb that their kidney disease would be cured, but ultimately they come with a lot of complications. So I would say that government should ensure that whoever is claiming that these medicine can cure, they should do some trials or something and actually show that these medicine could be useful or they are harmful, because we don't know at this time whether they are causing more harm than good. So I would caution people not to use these fall to these claims without actually having any scientific data behind using these drugs.
Agree with you. I mean, very important that they're scientifically proven before we move ahead with treatment with those medications.
Yeah,
Now,
because
kid,
we do not actually see oppose any kind of therapy, but it is important for the people to understand that you should not actually believe on the claims, because these are like claims. There are a lot of claims are being made in social media about getting returns in the market and other things. It is like those only, and then ultimately you are at loss.
I just want to take you up on that social media thing that you just talked about. There is such a spread of undocumented and unverified treatment on social media, something like the water bath, other things that, nature cures, and so on. How do we tackle this?
See, I think the only way to tackle, there are two ways. I think one is the initiative from the government, that you are claiming something and the actually not which is not true, and there is no scientific basis behind that, and they should actually ask these people who are promoting these things to prove their treatment. Secondly is to create awareness among people that this is actually a short term. I tell my patients who come to me after taking this treatment in sick condition that this is not useful. Their only purpose is to get your uh, time for 3 to 4 months, till the time there is some reserve in the kidney, and when the reserve is finished, then the person falls sick, and then he lands some the complication and starts and his cost of the treatment, his complication, all of them multifold. So, the from the public point of view, I would say to create awareness. That is what, as a society, as a nephrologist, we can do from our side. Otherwise, it is up to the government to actually uh, just prove that their claims and investigate that.
Just to take this forward a bit more, there are various reports about fairness creams these days affecting the kidney function. How do we inform the general public about this and the content of the fairness creams that is causing this problem?
Yeah, so thank you for asking that question, because we now see a lot of patients who coming to us with proteinuria, the excessive frothing in the urine, and when you test the urine, you find there's a protein in the urine. That is because of the mercury which is there in the fairness cream, which is many-fold higher than the recommended quantity. So what they do, they form some in body form some antibodies, uh, and that lead to the this one form of the kidney disease that is called membranous glomerulonephritis, and that causes the problem. And as such also, if you have any heavy metal that is there in the many of the alternative medicine and the other drugs, one is not uh, actually, there are many adverse effects which is seen with many of these drugs. So I would say that always check whatever you are taking, and if there is any sort of abnormal reaction or abnormal frothing, or any other problem, you should check your blood test and then see whether you have developed any kind of adverse effect of these drugs. In general, one should avoid using fairness creams which has high level of the mercury in that in these creams.
It's important, I think, from the government point of view, to have a drug authority or a CDSCO or somebody, a body which looks at the various components and decides on let us say, promulgating laws or banning these creams and so on, because that is something that if there's a governmental order that says you cannot use this or punish people who produce this, that also should help, isn't
Yeah,
it?
it has been proven. There's a study from India which has shown that there's a lot of these patients who had taken these fairness cream, they have developed this type of the disease.
Moving on to kidney transplantation. Obviously, most folks don't know that kidney transplantation is actually the best treatment for chronic kidney disease, stage 5. Even though dialysis is probably a stopgap treatment, kidney transplantation is the best. How do we go about increasing numbers of live related as well as disease donor transplantation in our country?
So, uh, as you said, that kidney transplantation is the best treatment, currently best treatment for the most patient with end stage kidney disease, because it gives a better quality of life, longevity life is better, and the ultimately the cost is also less. And there are many schemes in the government nowadays which support the underprivileged and poor people through various schemes like Ayushman and the other panels which promote the transplantation. But there's a huge gap, as you know, that the 1.5 to 2 lakhs people they suffer kidney failure, and only 13-14,000 kidney transplants happen in India, and rest of 40-50,000 go for dialysis. So that is the actual stats. So coming to this living donor transplant is difficult because see there's a nuclear family, and there's a lot of increase in the lifestyle diseases like diabetes, hypertension, and all that. So finding a living donor is going to be more and more difficult. I would place more emphasis on disease donor transplant, that people the more awareness is created through various channels, that after the brain death people can donate the organs. And see most of the western country, more than 60-70% of the kidney transplant are actually from deceased donors, and but India this figure is only 15%. So I would say that first is increase awareness, the people donate more, and then obviously if somebody in the family has this problem and the family members usually near relative, they there's no if there is no choice they donate the organs. But it is important to tell that kidney transplant is the way to go in these patients.
As the Honorary Secretary of the Indian Society of Nephrology, we've been doing so many things, so many innovative things with the association, which is very good indeed. One of those innovations is this patient advocacy committee that you've created within the Indian Society of Nephrology. How does this help the kidney patient?
Uh, Thank you, Dr. Arvind, for this important question. Actually, when I took over as the Secretary of Indian Society, it was my uh, endeavor to actually involve people across the country in various ways in creating various subcommittees, and one of those very important subcommittee was this advocacy committee, in which our purpose was to actually also take involve the patients and the NGOs who are working for the patient with kidney disease. So we have included two or three members from patients and the NGO who are working for kidney disease, and then we had regular meetings with them. And recently we had also actually given uh, a draft and to the government that these patients with kidney disease you should do the screening, create more awareness, and educate people. And when it is coming from the advocacy group and when the patient group and the NGOs, then it makes more impact. So that has been the purpose of this advocacy group, and we have also asked the time with the health minister to discuss it further, to promote awareness about kidney disease. And this World Kidney Day, our again we will try to have some sort of common platform with the patients, NGO, and the medical groups and Indian society to have programs throughout the country to create more awareness.
Thank you, Dr. Bansal. It's been a pleasure having you on Kidney Conversations, the podcast that comes to you from the Indian Society of Nephrology social media team. Please follow this podcast on Spotify as well as Amazon Music. Also, you can follow the Indian Society of Nephrology's social media bursts on Twitter at ISN underscore India and the same at ISN underscore India on Instagram. You can also follow us on Blue Sky, search for us as the Indian Society of Nephrology, as well as on Facebook. We also have a YouTube channel that brings out a lot of learning material, including the ISN India Journal Club, as well as the bedside clinics in nephrology. Thank you again, Dr. Bansal. So good of you to talk to us.
Thank you, Dr. Kanchi, for inviting me for this very important podcast. Thank you.
Thank you. So I'm going to end this here, and then another 3 to 4 minutes we'll do a Hindi one.
Oh,
The same, we'll just continue.
अच्छा अच्छा बिल्कुल. So you speak good Hindi. How do you?
No, no.
But
I
you.
speak okay Hindi, but I will manage. So we'll start. दोस्तों, क्या आपके गुर्दे ठीक है? क्या आपके गुर्दे सुरक्षित है? मैं कहने वाला था मित्रों, लेकिन हम कहेंगे दोस्तों. मैं डॉक्टर अरविंद कांची हूं, इंडियन सोसाइटी ऑफ नेफ्रोलॉजी के सोशल मीडिया चेयर और बैंगलोर में किडनी स्पेशलिस्ट का काम करता हूं. मेरे साथ है डॉक्टर श्याम बंसल, जो ऑनररी सेक्रेटरी है इंडियन सोसाइटी ऑफ नेफ्रोलॉजी का, और मेदांता हॉस्पिटल दिल्ली का डायरेक्टर है किडनी ट्रांसप्लांटेशन और नेफ्रोलॉजी यूनिट का. नमस्कार डॉक्टर बंसल, आप कैसा हैं?
नमस्कार डॉक्टर कांची. मैं बहुत अच्छा हूँ और बहुत बहुत धन्यवाद आपको कि इस पॉडकास्ट को शुरू करने के लिए और मुझे इस पॉडकास्ट में इनवाइट करने के लिए, मेरा इंटरव्यू लेने के लिए और बहुत ही अच्छी हिंदी बोलने के लिए. थैंक यू. धन्यवाद.
थैंक धन्यवाद. तो मैं शुरू करता हूं ये वर्ल्ड किडनी डे, जो गुर्दों के बारे में प्रोटेक्शन के लिए माना जा रहा है. एक टैगलाइन है, आर योर किडनीज ओके, डिटेक्ट अर्ली, प्रोटेक्ट किडनी हेल्थ. मतलब जो आपके गुर्दे हैं, आप कैसे उसे सुरक्षित रखेंगे? क्या कारण है भारत में कि गुर्दे फेलियर या किडनी फेलियर हो रहा है, और उसको हम कैसे सुरक्षित रख सकते हैं? डॉक्टर बंसल, बताइए.
हाँ, धन्यवाद डॉक्टर कांची. ये बहुत ही महत्वपूर्ण क्वेश्चन है. देखिए, किडनी की बीमारी आजकल काफ़ी कॉमन है. करीब करीब अगर हम स्क्रीनिंग करें, मतलब कि जिनको बीमारी नहीं भी, हम सारा पॉपुलेशन में अगर चेक करें, तो करीब 10% लोग ऐसे होते हैं जिनको किसी ना किसी तरह की किडनी की बीमारी होती है. ज़्यादातर लोगों को किडनी की बीमारी अर्ली स्टेजेस में, इनिशियल स्टेजेस में होती है. तो लेकिन बहुत सारे लोग क्योंकि टेस्ट नहीं करते हैं तो उनको पता नहीं चलता है, और हम अक्सर ये देखते हैं कि हमारे पास जो पेशेंट्स आते हैं वो लेट स्टेजेस में आते हैं, जब तक उनकी किडनी में खराबी ज़्यादा बढ़ जाती है. तो कुछ ग्रुप ऑफ पेशेंट्स हैं जैसे कि जिनको डायबिटीज़ है, क्योंकि डायबिटीज़ करीब करीब 30 से 40% लोगों की किडनी डायबिटीज़ की वजह से ख़राब होती है. जिनको हाई ब्लड प्रेशर है, स्पेशली ब्लड प्रेशर अगर कंट्रोल में नहीं है, या यंग लोगों में ब्लड प्रेशर है, तो ऐसे पर्सन को किडनी की बीमारी होने के चांसेस काफ़ी होते हैं. अगर आपको कोई हार्ट की प्रॉब्लम है तो वो भी एक रिस्क फैक्टर है किडनी की बीमारी का. अगर आपको वेट ज़्यादा है, ओबेसिटी है, वो भी एक रिस्क फैक्टर है. और अगर आपके फैमिली में किसी को किडनी की बीमारी है, तो ये 5 ग्रुप ऐसे हैं जिनको की किडनी की बीमारी होने के चांसेस ज़्यादा हैं. तो हम इंडिया में बिकॉज कॉस्ट की वजह से सबका तो टेस्ट नहीं कर सकते, तो कम से कम जिन लोगों को रिस्क ज़्यादा है उन लोगों को साल में एक बार अपना किडनी फंक्शन का टेस्ट, जिसको कि क्रेटनिन कहते हैं, और यूरिन में प्रोटीन का टेस्ट, जिसको यूरिन एल्बुमिन करेक्टिन रेशो बोलते हैं, वो ज़रूर करना चाहिए, जिससे कि किडनी की बीमारी अगर उनको जल्दी स्टेजेस में है तो वो पता चल जाए. और उसका उसी समय अगर इलाज शुरू हो जाएगा तो कई बार ये बीमारी वापस भी हो सकती है, स्टेबल हो सकती है, स्लो हो सकती है. तो कई सारे चीज़ें हो सकती हैं और हम आगे की जो परेशानियां हैं उससे बच सकते हैं.
डॉक्टर बंसल, धन्यवाद. आप ये जो मैसेज किया है वर्ल्ड किडनी डे के मुताबिक कि हम अपने गुर्दे ठीक रखने के लिए सिंपल ब्लड टेस्ट सीरम क्रिएटिनिन और सिंपल यूरिन टेस्ट यूरिन एल्बुमिन क्रिएटिनिन रेशियो जो साथ साथ करीब करीब 300 या 500 रुपए के अंदर ये दोनों टेस्ट कर सकते हैं और आपके गुर्दे को सुरक्षित रख सकते हैं। थैंक यू, धन्यवाद डॉक्टर बंसल। और ये मैं कहना चाहता हूं कि ये जो वार्तालाप है हमारे बीच में, ये आपको मिलेगा किडनी कॉन्वर्सेशंस। ये एक पॉडकास्ट है जो इंडियन सोसाइटी ऑफ नेफ्रोलॉजी के सोशल मीडिया पर मिलेगा और ये आपको मिलेगा स्पॉटिफाई और अमेजॉन म्यूजिक पर। आप अपने कार में रेडियो में डाल के आप सुन सकते हैं। साथ में @ISN_India ये जो हमारा आईडी है इंडियन सोसाइटी ऑफ नेफ्रोलॉजी का, वो ट्विटर पर, इंस्टाग्राम पर, ब्लू स्काई पर आप देख सकते हैं और हमारा यूट्यूब चैनल पर भी आप हमारे वीडियोस देख सकते हैं। धन्यवाद।
धन्यवाद।
दैट्स इट। आई
Okay.
थिंक
I
आई
hope
विल
it was.
एडिट इट एंड टेक इट।
Yeah, no. You really spoke well. I hope it was okay. Everything. Just you need to
Yeah,
something.
absolutely. I'll do some editing and we'll put
Yeah,
out
I will
the
also share on my page because I have not shared. I have a Facebook page. There were more than 2000 or something followers, but I usually don't post anything nowadays. But I can post this. So
fair enough. I'll send you some links once I separate out the English and the Hindi, and I'll separate it out and then post it and
thank you.
send it to
Thank
you.
you. Chalo.
Done.
So
Okay.
something tell me ki how we see advocacy committee actually. I should I because do you want to be part of the advocacy committee and we should do some meeting with them because there are
Yeah, I
two
think so.
people, but it has
We
been
can. Yeah.
not been very active. So what I'll
Not
do,
not just that, we
yeah,
can do some, patient reported outcomes through the
hmm,
advocacy committee because we'll have patients sitting on the board. We can tap into them and do patient reported outcomes, so we can actually publish some data. How does the patient feel about it? How
so
do so those sort of things we can do.
okay.
Yeah,
So what I
definitely.
will do
Very
because
interesting.
there are two or three people, I will just change it slightly and then see who is because when we last had one or two meeting, then we have taken senior people, but then very useful outcome did not come. So I want that maybe you can come, Vasundhara. We will invite.
So I'm
And
already talking to Vasundhara on a particular topic of non-adherence to medicines, and we have created a questionnaire
okay,
for distributing among dialysis patients and transplant patients. Why are they going into non-adherence? What is the problem? Is the doctor talking to you properly about the medication? Is he
yes,
talking to you properly about side effects? So
no,
that questionnaire is already ready. We just need to distribute and get it. So if we get it through the Indian Society of Nephrology to various nephrologists, we'll get a bigger group and we'll have a bigger survey.
yes, no, because two of our subcommittee they are underutilized because the chair. Because see, I cannot really do. I have given things to the chair, and this is the job of the chair of that particular committee to take it forward. The advocacy committee and the liaison committee. I tried one or two meetings initially. I kept, but then not much has been done. But at least we can actually restart this advocacy group, and then we can do something more useful from this.
Done, will do. You did not see my.
Yeah, I saw that. Oh, I saw
Okay,
that.
good.
Okay.
Next time, I'll make you wear it.
Yeah, sure.
Okay, bye.
Yeah.